Doc Medics, the medical study room.
Most mid-pregnancy appointments focus on visible milestones, a growing bump, the flicker of a heartbeat, or a detailed ultrasound. However, between 24 and 28 weeks, doctors require a glucose screening, a test that shifts the focus from anatomy to the mother's internal chemistry. This screening checks for gestational diabetes. It is a metabolic shift that causes blood sugar levels to rise specifically during pregnancy, even in women who have never had diabetes before. When blood sugar crosses this threshold, the biological environment of the pregnancy changes. This elevation is linked to high maternal blood pressure, complications during the delivery process, and an increased risk of premature birth. Despite these physical risks, the mother will feel perfectly fine. There is no accompanying fatigue, no blurred vision, and no thirst to signal that her glucose levels have reached a dangerous peak. Because the body fails to provide any outward warning, the blood test serves as the only definitive way to identify the risk before it impacts the mother or the baby. To understand the cause, we have to look at the massive influx of hormones the body produces to support fetal growth. These chemical signals flood the bloodstream as the pregnancy progresses. In a typical metabolism, the body uses insulin to help cells absorb sugar from the blood to be used for energy. For this to happen, insulin must successfully bind to receptors on the cell surface. However, pregnancy hormones can interfere with this process. They wedge themselves into the receptors, preventing insulin from binding and leaving the sugar trapped in the bloodstream. This is known as insulin resistance. As more insulin is blocked, sugar levels in the blood continue to accumulate. The mother's cells are effectively starved of energy, while her bloodstream becomes overloaded with glucose. While any pregnancy can trigger this resistance, certain factors increase the likelihood: a family history of diabetes, being over the age of 30, or carrying excess weight before the pregnancy began. The condition is a systemic side effect of the very hormones meant to sustain the baby. The same biological signals that drive fetal development can inadvertently disrupt the mother's ability to process energy. The mother's excess blood sugar eventually crosses the placenta. While this organ acts as a filter, it is permeable to glucose but blocks the mother's insulin, meaning the baby receives the sugar without the means to regulate it. This surge of glucose provides the fetus with surplus energy, leading to accelerated growth. This often results in a baby with a high birth weight, which creates significant physical risks during delivery. To manage the mother's sugar, the baby starts producing its own extra insulin. But once the baby is born and the umbilical cord is cut, the sudden loss of the mother's sugar supply, combined with the baby's high insulin levels, can cause the newborn's blood sugar to drop to dangerous levels. Without intervention, this mechanical imbalance changes the baby's structural development and threatens their survival in the first hours after birth. Although the biological risks are high, a diagnosis provides the information necessary to neutralize them. Identifying the condition early allows for immediate medical management. Most women can bring their blood sugar back to a safe range through lifestyle changes. Specific nutritional adjustments and consistent low-impact activity, like a daily walk, help the body use glucose more efficiently. If these steps aren't enough, doctors rely on frequent glucose monitoring and supplemental insulin. These injections provide the extra help needed to overcome the hormonal interference and clear the sugar from the blood. For the vast majority of women, blood sugar levels stabilize within days of delivery. Once the baby is born and the placenta is delivered, the pregnancy hormones that caused the resistance leave the mother's system. The long-term impact, however, remains. Women who have had gestational diabetes face a higher lifetime risk of developing type 2 diabetes. This history makes regular screening an essential part of their future healthcare. When identified through timely testing, gestational diabetes becomes a manageable part of the pregnancy. Careful monitoring ensures a safe delivery and a healthy future for both the mother and her child.